Hey, good morning, good afternoon, good evening, depending on where you are on this globe of ours. And welcome to another Thursday Live. I'm Dr. Jerry Dreessen, the Executive Director here at the AOPP. And today's live stream, we're going to be talking about, let me get that out. There we go. Little patients, big questions. We're going to be talking about um, pediatric PEMF safety, dosage, and real world case reports. So, with that, let's get cracking. I mean, basically, our question that we wanted to answer today is PEMF safe for kids? And the bottom line is, if you need to head on out today, the bottom line is yes, as long as it's done within the guidelines that we have for everybody else. And this not is only for our little ones as far as humans, but even small animals and stuff too can definitely benefit from it, and that's kind of the what I want to address today. So, with the three pillars that we want to tackle is safety, dosage, and then some real world evidence or examples of what has been done, so that you can kind of get an overview of what's accomplished or what can be accomplished. So, when we are talking about PEMF, some things to consider. Um, there's growing pains. In fact, I talk to my patients about the terrible twos and threes. It's because kids' bodies are doing this huge amount of growing, and actually, bone growth is painful, but they don't know it. They just know their body hurts. And they can't say, "Hey, mom, dad, my wrist, it really hurts right now because that bone is growing." They just, they ache. And so they're easily irritable because they're under a lot of unknown pain. Um, that can be helped by making sure that they're getting fed. And so, take a step over here on a slightly different podium. Nutrition is very important. If you are starving your kids from calcium, foods rich in calcium, and it's not just calcium, it's boron and silica, all of the things that are needed to help grow healthy bone. If they're not getting those nutrients, then you're starving them, and their body's trying to come up with ways to help their bone. Where on the other side, if you are giving them all the rich nutrients that they need to grow, they're going to have better twos and threes and not be so terrible. There we go. I said it. Um, so, some common pediatric use cases. So we've got growing pains, sports strains, sorry, and then ADH related focus issues and sleep regulation. So those are some of the things that we see, and we have to pay attention to those as they pop up, because it may be due to other things too. But here's the cool thing is PEMF can help with that as well. So when you hear your friends talk about kids having these problems, PEMF might be an alternative solution to some of these things. So why consider PEMF for kids? Well, PEMF is a whole lot different than what static magnets are or other electrical modalities. So if you've got a friend, or you yourself have a kid that's in sports and they sprained their ankle and they tried, doing a TENS unit or electrostim and it just didn't help. Again, remember, PEMF is not these. It's, in fact, most likely the practitioners, the physical therapists, may just start hearing about PEMF or they've never heard of it. And so, again, it's a totally different modality. You're going to get totally different results with it, which is great. Again, there are regulatory status as far as FDA clearances. It's already been approved for bone growth. And then also, which is important for you using it on you and your loved ones. If a doctor's like, well, I don't know if you should be using this, I've never heard of it before, but if you can give them the information, you say, well, here's the report, here's the FDA clearance on how it helps with bone growth. It can be done over a cast. And they're like, well, how does that happen? Well, it penetrates the cast, goes through everything. It's not, again, an electrical modality. You don't have to stick it to the skin of the person. It can be over top of things and have great healing properties. So kids and broken bones, right? Who do you know that's got a kid that had a broken bone? I think we've all, if not ourselves, uh, especially those of you that are out in horse and cattle country, probably a broken bone a year is apropos. Or uh, those of you that are in the city, breaking your toe, smacking a chair at 3 a.m. as you're walking across the living room. So all kinds of reasons why we get these things. But kids, especially, they'll just come in holding their arm. They won't tell you how they did it because they don't want you to know that they were jumping off of Timmy's roof, right? Or climbing a tree and they fell off. And oftentimes, kids just don't know. They'll show up and it's like, what did you do? Because the pain may not show up till the next day. And in their world, what they did to cause it doesn't exist. They just woke up with it. So good diagnosis, good treatment plan. Again, we've already got great things that are already FDA approved for kids. And I think broken bones and sprained ankles are, the key ones. And so, again, when you are going through these things, safety first. That's the main thing. And usually with kids, again, the lower field intensities, they are, again, non-ionizing and non-thermal. So it's not going to heat up an area. It's, if you've ever used PEMF on yourself, then you know what we're talking about. If you're watching this and you don't know anything about PEMF and you're like, wow, that can help with my kid's knee injury or ankle injury or shoulder injury. Again, child athletes, your pitchers, your, probably any position in baseball that involves throwing. So the throwing side, you've got soccer, you've got, all of these things that as kids growing up, if you can address these issues early on and get them feeling better, that's going to help their career last. Again, I'll take an aside here. So I have a patient, a 14-year-old female. She plays 3 different sports all at the same time. So any weekend could be 1 or 2 or all 3 of those sports. And she's starting to have knee problems. Well, we found out, number one, she had a short leg. So her leg was that much shorter. So she'd been creating this problem, even during her growth spurts. She's been creating these issues in her hip and her low back. We've balanced out her leg length, got her low back fixed, adjusted, but now she's starting to have knee problems because of this time of all of these, misalignments and things, but also it's the amount of hours. Some of you have kids that are athletes, and, it's a lot of playing time with very little downtime. There's all of these practices and things like that. Even the pros, they have one sport. So they have one practice for that one sport, and they're only playing games for that one sport. They're not doubling, tripling it up, different leagues, different, elite leagues and stuff. So kids really do can burn themselves out fairly early if they're not taken care of properly. And again, in the world of chiropractic, making sure the spine's aligned, the legs are the same length during growth spurts, making sure they're being fed. And then any injuries get taken care of quickly and allow rest time. And that's why I'm such a proponent of using PEMF with kid athletes, because you get lots of really cool results that are permanent. So, you can definitely help them out in getting them better. And then, of course, we have the literature snapshot. Lots of bone healing studies in adolescence, sleep, as far as neurodevelopmental disorders, so nutritional, those kinds of things. PEMF is great for opening up blood flow and allowing better absorption of all of these things. And then, of course, no serious adverse events. So there might be some restlessness or tingling going on using PEMF. The restlessness is because the body's detoxing and powering up, and or if they're absorbing their nutrients better. So, it's always been in my opinion, a positive thing using PEMF. I've never had a a down. I've never had an adverse reaction except for the patients. Again, those of you who've watched these videos know patients that think that they need more, and so they'll turn up the intensity. If those of you that have a dial intensity versus a button push, and they end up hurting themselves because their whole body contracts and they're just not ready for that. So they're sore the next day. Or if they have a disc problem, that they're contracting around the disc and creating more inflammation. So to me, that's been the only bad problem or bad part. Or if they're on medication and they're just absorbing too much medication because their body's more efficient. So again, practical safety checklist. There's the contraindications, as far as implanted pumps and shunts. If they're having any kind of seizures or unknown genetic syndromes, those are things to be aware of because, again, if they're having seizures and they're on medication, sometimes overdosing on the medication could cause seizures. Those of you that are in the pharmaceutical world, gabapentin's being used quite a lot now for things other than seizures, being used for pain. So if somebody's on gabapentin and they're not epileptic, the body absorbs more gabapentin, and that can create seizures from having too much or even withdraw from gabapentin. So know your medications too, and of course always make sure that with minors that there's a parent supervision and that there's a consent to treat form with them. We provide all of those for our members on our membership side. The next thing is dosage consideration, and those are some major things because we want to make sure that kids are getting the right dose. And so our main thing is go low, go slow. And that's always been it. It's always test first. Oftentimes, the very first time people get PEMF is a small amount, and low dose, low time, and see how they do with that. And then if they do better, then you can work them up versus hitting them really hard. Those of you that have used PEMF quite a lot, you can just jump right in and crank it up to the last setting that you used and you'll be fine. But for a lot of people, this is brand new. And they may not recognize what it's like to have PEMF done or even the after effects, what it's like. So that's probably, out of all the slides I do today, slide number 12 is the most important. Go slow. So some treatment frequencies. This is kind of a guideline. This is not hard stone, but if you want to look at some ideas, again, 5 to 8 minutes would be like top on a 4 to 6 year old, and be thinking about this for small animals too. Infant animals, I guess, but you want to use smaller amounts, and the body is growing, so you don't want to accelerate the speed of growth. So you want to get in there and help with inflammation and stuff. But if you're in there and you create a faster cellular process, just remember the younger the person, the more growth is happening. But if you can get in there and knock out inflammation while they're in the growth process, then that's even better. Age 7 to 12, around 8 to 10 minutes, 3 times a week, and you can increase that in 1 minute intervals if it's tolerated. 13 to 17, 10 to 15 minutes, 3 to 4 times a week, and then after that, then you can bring that up. And also, again, size. If they're these huge kids, you can get away with doing more because you've got to get through their body a little bit more. But if you use this as a standard guideline, you should fare pretty well with what you need to do. And then again, adjusting on the fly. So observable cues, improve sleep, mood, pain levels, all of those changes are important. When to pause or reduce as if there's any kind of hyperactivity post-session, if they have a headache or skin warmth. Again, oftentimes the headache is because there's a detoxification going on. So, drink water before, drink water after. If there's still a headache, then you just need to lower either the time or the intensity or both, and continue to use PEMF, but just do a little bit less. And then just make sure that they're, again, drinking lots of water. Sometimes parents, if you're not really thorough, they might say, oh yeah, I forgot to tell you, they're also taking blank, but I didn't think it was important, so I didn't tell you. So that'll happen at least once in your career when this is going on, even if you ask them, which is, again, where am I? Yeah, let me just jump up here. So very interesting fact. Here I am, chiropractor. I've got cases coming in, auto accidents. I'm an auto accident expert. But I'll have people come in and they're in their 60s, 70s, and they've got this neck and back pain. And we have them go through a checklist, and we have them go through a examination. And they're coming in for neck pain. I can't figure out what's going on, and I'll take X-rays, and they have a reverse curve with some degenerative changes in their neck. And I'll look at them and go, you didn't tell me you were in a car accident. When I asked you, you said no. They said, well, how do you know? And I'm showing them an X-ray of their neck. I said, how long ago was that? And they'll go, oh, yeah, that was back when I was a teenager, but I didn't think it was relevant. It's like, this is why you have your problem. It was because you were in an accident as a teen and you never got anything done. It just stayed that way. And now it's gone through degenerative arthritis, and that's why you are the way you are. And so that's my, I'll step off my soapbox here. There we go. Again, that's another thing is people, they don't necessarily lie to you. They just don't think that it's relevant enough to tell you. So you gotta kind of poke them a little bit and get more information. And then, of course, some example case reports. 8-year-old soccer player, ankle sprain, 6 sessions, 8 minutes each time, return to play in 10 days versus the 16-day team average. 10-year-old with ADHD-related insomnia. They were on a nighttime mat, about 7 minutes. They were able to fall asleep faster and sleep longer after 3 weeks of being on that. Again, that's a very low dose. 15-year-old post-orthodontic pain, so they used a handheld applicator. 5 minutes bilateral jaw. The pain score dropped from a 6 down to a 2 on a 0 to 10 scale within 24 hours. And they'll jump in here. I got to watch that happen. A guy came in after he had his tooth pulled, jaw swollen. We used the double loop handheld, held it against it, and we both literally saw it just melt, and the swelling and pain went down in 10 minutes. And again, if you watch any of these replays, you know that I've talked about kicking myself for not having a freaking camera to show all of that happening. Wouldn't that have been awesome to have been able to see that actually happen? So those of you that are treating people that have things that are swollen, pull out your camera and again, ask them for permission, but do a post or film the whole event happening and see if you can't tell that there's a reduction in swelling. That would be great. And if you do have that footage, if you could share it with us, we can put it on our website. That would be even cooler. And again, some things that, I don't know, these are far less happening now, but people would say PEMF stunts growth. Kids feel nothing, so it isn't working. Higher intensity is always better. These are some of the myths. PEMF does not stunt growth. It does not stop things from happening. If anything, it improves things. So there isn't anything out there either in the literature that shows that there's any kind of stunting of growth. Kids feel nothing, so it isn't working. We ourselves, I can put PEMF on my hand and I'm not going to feel it, but I take that same intensity and I'll put it over my chest. And my muscles are contracting and thumping away. So it has to do with the amount of soft tissue, the density of the person, how much tissue density there is in the treatment area. And oftentimes adults have a lot more networking going on inside their body as far as nerves and arteries and veins. So just because they can't feel it doesn't mean it isn't working. Higher intensity is always better. We all know that that's not true. And always start low and slow and work your way up. Even if they say they can't feel it, That does not mean that you should bump it up. All right. Well, again, the big takeaway or the key points today. So proven safety profile, child scaled dosing, and promising case data. If you yourself have treated somebody and you've got some really good information for it, again, I want to encourage you to share all that stuff with us as we go through these live streams every week. And if you have something that you'd like to share, jump in and do it. You can drop it in a comment right now on today's live, or you can do that afterwards. You can go to any of our YouTube videos as well. We've got Instagram, Facebook, LinkedIn, YouTube. Drop it in the comments. You can also email it to us, info@pemfprofessionals.com. We'd love to share your information with everybody as well, because we're all becoming experts in this new field. And again, the more you're out there using it, the more of the on the ground expert you become. And I'd love to even chat with you about that too. So if that's something you'd like to do in the future and come on live and get interviewed, I would love to do that too. That's always a fun thing to do. Just ask you some questions about what you do with PEMF and some case studies that you've done. If you are not a member and you're considering, we've got a whole bunch of stuff. You can come in and get certified. You can become a member. We've got lots of really cool things on the membership side, some videos that we've recorded specifically on the inside for members. We've got websites, we've got backlinks, we've got a whole bunch of things. And so you can check that out, become a member today at our website, pemfprofessionals.com. And again, send your questions and tips to us as well. So with that, I want to thank you so much for your time today. It was always a pleasure to get a chance to chat with everybody. We have a pretty good crowd joining us today. So I want to thank you today and look forward to seeing you down the road. We've got some more great things happening, of course, with our PEMF Con coming up in the fall too. So stay vigilant out there, treat people, do good things, and we'll see you again next week. All right. Thanks.